Carpal tunnel syndrome. Carpal tunnel syndrome, also called median nerve compression, is a condition that causes numbness, tingling, or weakness in your hand. It happens because of pressure on your median nerve, which runs the length of your arm, goes through a passage in your wrist called the carpal tunnel, and ends in your hand. The median controls the movement and feeling of your thumb in the movement of all your fingers except your pinky. Carpal tunnel syndrome causes. Often, people don't know what brought on their carpal tunnel syndrome. It can be due to repetitive motions, like typing, or any wrist movements that you do over and over. This is especially true of things you do when your hands are lower than your wrists. You might have a higher risk of getting carpal tunnel syndrome if you are a woman. Women are 3 times more likely than men to get it. This might be because they tend to have smaller carpal tunnels. Have a family member with small carpal tunnels. Have a job in which you make the same motions with your arm, hand, or wrist over and over, such as an assembly line worker, sewer or knitter, baker, cashier, hairstylist, or musician. Fracture or dislocate your wrist. What are the symptoms of carpal tunnel syndrome? For many people with tingling, pain, or numbness in their fingers, carpal tunnel syndrome is the first thing to come to mind. It's a common condition, but it's not the only one that causes problems in your hands and wrists. It helps to know what to look for so you can get the right care. Early treatment can make a big difference in how long it takes to get better. The symptoms of carpal tunnel syndrome can include 1. Numbness, tingling, or pain in the fingers, particularly the thumb, index, and middle fingers. 2. Weakness in the hand or difficulty gripping objects. 3. Pain or discomfort in the wrist, forearm, or elbow. 4. A sensation of swelling in the fingers or hand, even when there is no actual swelling present. 5. Shooting pains that radiate up the arm towards the shoulder. Typically, the symptoms start out slowly, with burning, numbness, tingling, or pain. You might feel it in your thumb and any of your fingers, but not your pinky. The strange feeling may also travel up your forearm. Often, symptoms start at night. That's because most people sleep with their wrists bent, which causes pressure on the median nerve. You might wake up feeling like you need to shake your hands out. As your condition gets worse, you may notice symptoms during the day, as well. This often happens when you're doing something where your wrist is bent up or down for a long time, like driving a car, reading a newspaper, or holding your phone. At first, symptoms tend to come and go. But over time, they occur more often and become worse. You might also notice other symptoms. Your fingers feel swollen, even though they don't look like it. Pain and tingling travel up your forearm to your shoulder. Shocks come and go in your thumb and fingers. Over time, carpal tunnel can also affect your grip and ability to pinch. Here are some things that could be happening. You drop things more often, due to numbness or weakened muscles. You're having a hard time working with small objects, like the buttons on your shirt. It's harder to make a fist than it used to be. In more severe cases, you can lose muscle at the base of your thumb. Or you may no longer be able to tell hot from cold just by touch. How do you treat carpal tunnel syndrome? You have a lot of options when it comes to treating carpal tunnel syndrome. Just remember that what helps your friend or neighbor may not work for you. You may need to try out different approaches to get the relief you need. The treatment for carpal tunnel syndrome depends on the severity of the symptoms and the underlying cause. Mild cases may be managed with self-care measures, while more severe cases may require medical intervention. Some common treatments for CTS include 1. Wrist splints. Wearing a splint at night can help keep the wrist in a neutral position, relieving pressure on the median nerve. 2. Medications. Nonsteroidal anti-inflammatory drugs, NSAIDs, or oral corticosteroids may help reduce inflammation and alleviate pain. 3. Physical therapy. Exercises and stretches can help improve flexibility and strength in the wrist and hand. 4. Steroid injections. Injecting a corticosteroid into the wrist can help reduce inflammation and provide pain relief. 5. Surgery. If conservative treatments don't relieve symptoms, surgery may be necessary to release the pressure on the median nerve. The most common surgery for CTS is called carpal tunnel release, which involves cutting the ligament that's pressing on the median nerve. It's important to note that early treatment is key to preventing long-term nerve damage and disability. There's no one surefire way to prevent carpal tunnel syndrome. But if you reduce stress and strain on your hands and wrists as much as you can, you may keep it from getting worse. While it may not be possible to completely prevent carpal tunnel syndrome, CTS, there are several steps you can take to reduce your risk of developing the condition or prevent it from worsening. Here are the things you can do to prevent carpal tunnel syndrome. 1. Take frequent breaks. If your job involves repetitive hand and wrist movements, take frequent breaks to stretch and rest your hands. 2. Use ergonomic equipment. Use ergonomic keyboards, mice, and other equipment that is designed to reduce strain on the hands and wrists. 3. Maintain good posture. Keep your wrists in a neutral position and avoid bending or flexing them for long periods of time. 4. Stretch your hands and wrists. Regular stretching exercises can help improve flexibility and reduce the risk of CTS. 5. Use proper technique. When performing activities that require repetitive hand and wrist movements, use proper technique and avoid excessive force. 6. Maintain a healthy weight. Being overweight can increase the risk of CTS, so maintaining a healthy weight can help reduce your risk. 7. Manage underlying conditions. Certain conditions, such as diabetes and arthritis, can increase the risk of CTS. Managing these conditions can help reduce the risk. 8. Talk to your supervisor. If your work triggers your symptoms, ask your manager about changing up your workspace. You may be able to alter anything from your workstation setup to tool handles to how tasks get done to see if it helps your symptoms. You might also be able to trade off with coworkers so you can avoid the same task over and over. If you work at a computer, try these things. Adjust your keyboard position so you don't have to bend your wrists when you type. Keep your elbows close to your side as you type. 9. See an occupational therapist. This medical professional may be able to show you exercises to help stretch and strengthen your hand and wrist muscles. Show you how to change your routine motions in a way that eases stress on your hands and wrists. By taking these steps, you can help reduce your risk of developing carpal tunnel syndrome or prevent it from getting worse if you already have the condition. If you're experiencing symptoms of CTS, it's important to see a healthcare professional for an accurate diagnosis and appropriate treatment plan.